8:13, humidity's down, feels a little bit better outside at least. Yeah, strokes, the fifth most common cause of death in the United States and leading cause of long-term disability. Luckily, a lot of strokes are preventable. Dr. B joins us now, our friend Dr. Brent Wallis, Chief Medical Officer at People's Health. How you doing, Dr. B?
Hey, Tommy, I'm good. How about you?
I'm okay. It feels good with the humidity being a little bit lower. Not quite fall-like, but...
I was going to say it's like fall out there, or at least it feels like it compared to 100.
Better than it was, yeah, in triple digits. So we're going to talk about stroke symptoms and steps you can take to reduce your risk. And I guess we got to start, Doc, with what is a stroke?
Yeah, so a stroke is a very serious brain injury, and it's something that happens really when the brain doesn't get enough blood flowing to it. So without that steady supply of blood, it also doesn't get the oxygen that it needs, for those brain cells to process things and for you to think. And so if you don't restore the oxygen quickly, those brain cells can actually die. And when they die, that can cause permanent brain damage or a lot of long-term health complications. So it's a really serious condition.
Are there different kinds of strokes?
Yeah, there are. There's really two major types of strokes that we see. The first is called ischemic strokes. The second is called a hemorrhagic stroke. So an ischemic stroke is actually what happens when the blood vessels in the brain are blocked, or maybe they're too narrow for the blood to actually flow through them and get to the brain. And that's the much more common type. About 87% of all strokes are ischemic. The less common type that we see, like I mentioned, is called hemorrhagic. And what that is when the blood vessels in the brain actually leak or they burst. That can cause bleeding in and around the brain. And then there is another, not stroke, but another condition that's also very concerning. It's something called a transient ischemic attack, or a TIA, and some people call those mini strokes. So what those are is it's a condition that actually causes temporary stroke-like symptoms in a patient, but it doesn't result in the permanent brain damage.
That's interesting. Tell us more about these mini strokes.
Yeah, so these mini strokes are really a signal that you've got some high-risk conditions going on, and they actually can be an indication of possibly having a more serious stroke or a full stroke in the future. And so about 1 in 3 people who have a mini stroke will eventually go on to have a full stroke, usually within the first year. So I consider them kind of a warning sign that something bad is going on and you need to really pay attention and talk to your doctor about it.
Wow. What are some of the risk factors for a stroke?
Really, anybody can have a stroke, but there are people that are a little bit higher risk than others. They're much more common as we get older, so later in life. About 2/3 of strokes happen in people that are over the age of 65, and then sex is actually another risk factor. So men are more likely to have strokes at a younger age. But interestingly, because women tend to live longer, they actually have a higher overall lifetime risk of having a stroke. And then family history plays a huge role in it as well. So if you've got a relative that's had a stroke, you're more likely to have a stroke. And then the other thing is if you've had one stroke, you're more likely to have more strokes as well. So if you've had one, you really need to make sure you're being treated.
Wow. What are some of the symptoms?
Yeah, so, the way it works, your brain is very complex, but there's different areas within the brain that control different parts of your body. And so the stroke symptoms are going to vary really based on where the problem is in the brain. But there are a couple of symptoms we see that are pretty common across all strokes. So things like headache, trouble walking or stumbling. Some people will develop difficulty speaking, or they may even have trouble understanding others that are speaking to them. And then we do see vision changes sometimes, maybe trouble seeing out of one eye, maybe having double vision. And then another common symptom is actually numbness, and it can be of the face, the arms, the legs, but in particular when it's happening only on one side of the body, that's a really big warning sign that possibly you're having a stroke or even a mini stroke. But the thing to really remember is, stroke is a life-threatening emergency, and every second really counts, it's kind of like a heart attack. I call it a brain attack, essentially. So if you notice any of these symptoms in yourself or in your loved one, then quick treatment is really critical, and that improves survival rates and really prevents a lot of those long-lasting complications.
How do you determine, or how do you make sure that somebody is having a stroke or isn't having a stroke?
Yeah, I mean, for the general public, we use a memory tool that kind of helps a little bit to know what to look for, and it's called ACT FAST, like FAST. So if you're worried somebody may be having a stroke, you want to think of the word fast because you need to act fast on it. And the F stands for face drooping. If somebody's got drooping, especially on one side of their face, maybe they smile and one corner of their mouth doesn't turn up, that's a big warning sign. The A stands for arm weakness. So if they're having weakness in their arms, what I usually do is I have them lift their arms up or put their arms out in front of them. And if one arm can't go up as high or it starts to fall back down, that's a really bad sign as well. And then the S stands for speech. So speech slurring in particular. If people are stumbling over their words and are having trouble getting the words or phrases out, that could be a sign that something's going on. And the T, the last part of FAST, F-A-S-T, is it's time to call somebody. You've got to call 911, really. This, like I said, is a medical emergency, and every second you can get somebody to the hospital quicker if they're having a stroke is going to improve their outcome and really their survival rate.
Boy, time is of the essence. Some very important information. We're talking about strokes with Dr. B, Chief Medical Officer of People's Health. When we come back, we'll talk about some of the short-term or some of the long-term complications that may come with a stroke and how to prevent them. 8:20 now, time for traffic, WWL. 8:26, Tommy Tucker, WWL. Quickly back to Dr. B, Dr. Brent Wallis from People's Health, talking about strokes and ways to know if somebody's having a stroke and what to do. And now we're going to go, Dr. B, into some of the long-term complications that may come with a stroke.
Yeah, I mean, like we were saying, it depends on which part of the brain is affected and how long it goes without oxygen. So you can sometimes get some temporary problems, or they can be really profound and permanent disabilities for people. It's very common for people after a stroke to develop depression or even chronic pain, and those have to be treated separately as well. It's very common that we'll see paralysis, or limited mobility, especially on one side of the body. We had talked about some of the complications with talking and communicating, and people can have slurred speech or really difficulty holding conversations and understanding what people are saying to them. And then memory loss can be a really big problem in people with strokes. So it can be a lot of really critical issues that happen after a stroke.
Certainly want to avoid that if you can. How can you prevent a stroke?
Yeah, I mean, the good news is they can be prevented. In fact, the CDC really estimates that about 80% of all strokes are preventable. But what's really critical is that you have to lower your risk level, especially, like I mentioned, if you've had one of these TIAs or transient ischemic attacks or mini strokes, that's a warning sign to you. And so it's really critical to start thinking about healthy lifestyle changes. And we talk about these all the time, but they really affect stroke in particular. Eating nutritious food is going to be extremely important. Plenty of fruits and vegetables, things like whole grains, low-fat dairy products, and lean proteins. You want to avoid foods that are high in salt, high in fats, things like cured and red meats and prepackaged foods. Those are all going to increase your risk of stroke in the future.
What role does exercise play in this?
Yeah, exercise is huge. Just like in a lot of other chronic illnesses, it's really important to make sure you stay as active as possible. It doesn't have to be super intense exercise. Just walking around your neighborhood, taking the stairs when you can, park further away at the grocery store and get a little bit of exercise and kind of work your way up as best you can. We always say 30 minutes a day, 5 days a week. So 150 minutes a week is really what your goal is, but always talk to your doctor before you start an exercise program because they may have certain limitations or things they do or don't want you to do. So make sure you talk to them about that.
Some final thoughts about stroke prevention, Doc?
Yeah, there are a lot of chronic conditions that increase your risk for stroke, and in particular, it's kind of the big three we talk about all the time: high blood pressure, high cholesterol, and diabetes. Those dramatically increase your risk for stroke in the future. High blood pressure is really one of the leading causes of stroke. It doubles your risk for stroke. But if you have any of those conditions, you want to make sure you work with your doctor, make sure you've got a good treatment plan, that you know about your disease, and absolutely that if you've been prescribed medications, that you take them the way that they're prescribed. Because if you can reduce the risk of those disease and keep them under control, you're going to reduce the risk of stroke in the future.
Smoking, you didn't mention, but I know.
Absolutely. Yeah, smoking causes all sorts of problems. Stroke is definitely one of them. It increases the risk of stroke dramatically. So stop smoking if you are.
Thank you, Doctor. I appreciate your time. Dr. Brent Wallis, Chief Medical Officer of People's Health. If you want to find out more about People's Health, you can go to peopleshealth.com. You can visit the People's Health Medicare Center at 3017 Vets in Metairie, right next to Party City. Appointments are recommended, but walk-ins are welcome. You can call 1-800-978-9765, and you can always follow People's Health on Facebook, Twitter, and Instagram. We come back, we'll talk to Jeff Nowak about the Saints practice squad. That's set right now. Time for WWL First News. For that, we go to Dave Cohen.